As we are live.
Okay, are we ready?
Yep.
All right, we'll go ahead and bring the Police, Fire, and Health Committee meeting to order. We have Kara Alt with us and myself, Fire Chief Jackson, and Trish Factor from the Health Department is here. Council President, Mr. Watt, and the mayor. And if I could have somebody excuse Ken Botkins. If I could have a motion to excuse Ken Botkins from tonight's meeting.
I'll make a motion to excuse Ken Botkins from tonight's meeting.
Okay. Then can I second that, Jolie?
Yeah. Yes. Yeah.
Okay, then I'll second that. Okay. And then I also will need an approval of the minutes from the last meeting. And Kara, you were not here for that, correct?
Well, and the last meeting was not December 17th.
Right. Do we need to make a correction on that or?
Well, I don't, yeah, well, we can correct it. And then when you approve the agenda as corrected, so yeah,
Okay.
It was October 15th.
So can I make the motion since Kara was not here for those?
Yes, because Thomas has ruled on that you can't, it'd probably be good for you to make the motion. She can say, and she can vote on it. So
Okay.
yeah.
So I'll make a motion to approve the minutes as amended with the corrected date.
I think the minutes are okay. The agenda only has the wrong date for the minutes. It was all the minutes. I said,
okay.
right? Yeah.
Okay.
So,
All right.
yeah. Okay.
So I'll make a motion to approve the minutes
From October 15th instead of
from
December 17th.
October 15th. Okay.
Julie, did they have a motion to approve vote on excusing Mr. Botkins?
Yeah, she did.
Did I miss it? Okay.
Yeah.
Sorry about that.
So we need Kara to second the.
Yes.
Okay, I'll second it.
Okay. All right, then we can go ahead and get started. The first thing on our agenda for tonight is.
We need to approve the agenda as amended.
Oh, I'm sorry. Okay, I need a motion to approve tonight's agenda. as amended.
I'll make the motion to approve tonight's agenda.
Okay, and I will second that. And now we can move on to Chief Jackson is here to discuss some grants. Always good.
Every year I come to you guys for approval and for some information on the FEMA grant program, the Assistance Firefighter Grant program. This year, it varies on the time frame because we never really know when they're going to release or open the application period. Well, they've done it for one of the grants just a week ago, and we have the 30 days to apply, and the next one is opening here at the end of the month, and we've got 30 days from January 25th to apply. So the first one we're going to talk about is the Fire Prevention and Safety, the FP&S grant. And that usually goes, if you recall, back some time ago, we received a sizable FP&S grant for smoke detectors and house numbers for all residents. In fact, we're still administering that program with the house numbering. And we really haven't had a project that qualifies for this in recent time. We did a couple years ago attempt the same grant for this exact same piece of equipment. And we were turned down because you kind of remember that this is they give out like 35.5 million, but only about 100 awards, and there's almost 30,000 fire departments across the country. So it's kind of hard to get some of these FEMA grants. We were lucky once, and we're trying to test our luck again. And what we'd like to do with this $25,000 grant is buy a extinguisher trainer, a fire extinguisher trainer. Most our businesses have to have annual fire extinguisher training. We do it with it used to be a pan of diesel fuel and light it and let people use real extinguishers. And then we went to a propane type system with fake water extinguishers, which works out well, but it's just a lot to get around. And it's an old system now. So now with technology, there's video monitors that you can come and shoot an extinguisher at a video monitor, and that satisfies the training requirement. And it's kind of neat, and it's not something that, maybe we should ever think about putting in the budget. It's because it's a nice to have item, but with the federal government, paying 95% of the cost and us only putting out, $1,000 for something like this instead of the 25,000, it's kind of a no brainer. Helps our businesses, saves them money from having to buy extinguishers or rent extinguishers for this training. So that's the first one we're talking about. It's 25,000 altogether. 23,810 would be the federal share, and $1,100 would be the city share, and we have that in the budget. So I wanted to run that by you and get approval to go ahead and apply and accept if awarded that grant.
Okay, can I have a motion to send that on to full council?
I'll make the motion to move that on to full council.
Okay, and I will second that.
Thank you. The second one is the one we also did in 2020 and did not receive. And we've been really fortunate with grants throughout my time being there and even before. But this one is to replace hose. Hose, basically you lose a few sections about every fire you go to, and when you have to test it to the national standard every year, you lose a few sections to that. So we've been replacing piecemeal, and this grant would basically in one foul swoop come in and replace all our hose with updated fire hose, if you will. This one, same thing. It's a 95.5 grant, with the grant being for about 48,000 and some change. The federal share would be 46,125, and our share would be 2306. It was in our share, the city share is in the budget and under the capital line item already. So it's already there. And that particular grant has the application period of ending on February 12th. So we've got a few weeks left on that.
Okay, that sounds great. Both of those sound like promising grants. Always good to hear. Can I have a motion to send that second one on to full council?
I'll make the motion to send it to full council.
Okay, and I will second that. Thank you, Mr. Jackson.
See you,
Appreciate-
Bill.
Yeah. See you, Mayor.
And then we'll see you at the next meeting as well, right?
Yeah, I'll do my annual report next meeting.
Okay.
Date you on all our numbers and answer any questions you may have. So, okay.
Thank
Thanks,
you.
guys.
Okay, next on the agenda is Trish Factor from the Health Department. You're going to give us some updates on the COVID.
Oh, yes, everybody's favorite subject now, right? I actually look forward to talking about non-COVID pieces, but I figure, right now we've not been able to produce the extremely detailed reports for council that we were early on in this. Again, because it's evolving and it's changing so rapidly. So I just wanted to make sure that you all were kind of up to speed on where we're at with things. So as of today, at least right now that we've confirmed everything, I'm at 856 cases, and that's just of Galleon residents.
These are active cases.
This is how many cases cumulative, so total
Okay.
that we've had. Right now, we are at one of the lowest active case counts that we've been at in months, which is a tremendous feat. We have, right now, there are only 45 active cases within Galleon, which, maybe 6 months ago, we would have been like, cringing about, but considering we've been in the couple hundreds here recently. All of our long-term care facilities within Galleon, all of their outbreaks are completed now. We don't have any more active cases within those facilities currently. We monitor and we still speak on a very regular basis to each one of those individual facilities. right now they're just hoping that nobody gets a reinfection, because we're kind of at that time frame where somebody could have resolved, been considered recovered, and then potentially get reinfected. So we're really hoping that doesn't happen. I think all of those facilities have received at least their first round, if not both rounds of vaccine at this point. So I do know that they should have all been offered at least the first round. They're all getting their vaccines through the federal pharmacy program. So there are people going into the facilities and actually vaccinating any of the residents and staff that are interested there. We've also started in on not just a case investigation, I think we're still doing contact tracing. We're still one of the only jurisdictions that's doing full contact tracing. So contacting and quarantining individuals that have been in contact with a confirmed case. We really believe that that's keeping our counts down. Most of the surrounding areas are not doing full contact tracing. There are some that are just doing it for those that are maybe living within the same home. Some have just said, hey, you're a case, tell anybody that you were in contact with that they should self-quarantine. We're actually doing it and issuing the order. So we do believe it's keeping those numbers down. We do have more recently, we've had more and more people that are just refusing to speak to us, not answering the call, or answering the call, and then when it comes time to report their symptoms on a daily basis, they'll refuse. So, I mean, we are having more and more pushback right now, but we do our best to really educate them and say, hey, this is just to make sure that, you're going to be okay. Everything's going to be fine at this point, those types of things. So, we're doing our best to educate there with our contact tracers. And they've done a phenomenal job. And then we are moving on to vaccinating. So that's exciting. We have vaccine. We're working on that. We do have a pre-registration on our website. So on our website, we have a new page on our website.
Trish,
that
are you
is-
guys able to administer the vaccine?
I'm sorry?
Are you guys able to administer the vaccine at the health department?
Yes, that's what we've been doing. Yep.
Okay.
Yeah, we've been doing that for a little bit now. Actually, Phil just got off the Zoom, but he just got his second dose today. So our fire EMS folks, they received their second doses today. So they're our first ones to be 100% covered here in Galleon. So that's awesome.
That's good for the community to know that if they have a EMT coming into their house, that they've been vaccinated. I think that's a
Yep.
good thing.
Yep. So that's awesome. And we got we've been hearing about compliance issues with the vaccine, from across the state. Some EMS workers weren't wanting to get it. Some, healthcare workers weren't wanting to get it. We're not seeing the same kind of trends here in Galleon. Just EMS alone, we've got over a 94% acceptance rate in taking the vaccine. So
Nice.
that's a good thing.
Mhm.
They're protecting those that are most at risk right now. So that's amazing for us.
Who are you able to vaccinate now at this point?
We are still currently on the 80 and above age group this week. Next week begins the 75 and over. We still have plenty that are 80 and over to get to. So that's one of the things that we're struggling with. We want to be able to get it into the arms of everybody that wants it right when they're due for it and everything. The problem that we run into is we only receive so many doses at a time. And you know, we've only got so many people. You got to get the people, get it in people's arms, but you got to have the vaccine itself. You've got to have it. So with not knowing week to week how many doses we're getting, it makes it fairly difficult. What we have done, we're one of the few agencies in Crawford County, and I don't know if anybody else is doing a pre-registration like we are. What we're doing is we're asking people to go onto our website if they have access to the internet. If not, you know, we'll work with them. Otherwise, we know with the populations that we're trying to get to right now, not everybody is computer savvy or even has a computer at home. So what we're doing is accepting pre-registration. It doesn't guarantee that you get vaccine, but what it does is it lets us know that you're interested in receiving it from us. Then what we do, there's a series of questions in there so that we know what kind of demographic you're in and when you would even be eligible for the vaccine. So then we sort through that. Anybody that's age eligible right now, in order of how they've come in, we will call them, we'll get them in to any appointment slots that we have available based on the number of vaccine doses that we know we have. If we get additional vaccine, we're able to then open it up to even more. So it's really, some people will call back regularly. Hey, am I on? Do I have an appointment yet? We will call people. By pre-registering, it gives us the ability to call you. Almost every health department across the state has had phone lines crash. The whole phone systems have crashed because of the influx of calls. You know, when this opened up for the 80+ group statewide in Crawford County, I believe every provider that received vaccine that week were out of appointment slots before the end of the day, if not within an hour of them going live. It's wanted. We're working through all of it. We do have wait lists. The pre-registration is what we consider our wait list at this point. If you said you're interested, if you're the next one in line to get an appointment slot, we're going to start calling you. And if you're available to come in, if we are able to pull an extra dose, that's what we're going to do. You know, we're very cognizant of the fact that right now we're getting the Moderna vaccine. Each one of these little vials, this is an empty one, so each one of these little vials, we should be able to get 10 doses out of. Every now and then we can squeak an extra dose, sometimes 2 out of it. So when we set up our appointments, we set it up based on 10 doses per vial that we have coming in. And then if we have additional doses, we start picking and pooling. If we can't get a hold of anybody rapidly, the thing is that once we puncture that little vial, everything in that has to be administered within a specific time frame. Otherwise, it goes to waste. So it is important to keep in mind that, you know, we do have some people that are willing to just come right over, you know, call me right away. We try to get them in there that way. I think that's the only time, like, we did not prioritize even our own staff getting this. If there was an extra dose, we prioritized our staff internally. So even all of our staff have not gotten this yet. It's if we can't get somebody else in, we're getting them through here as quickly as we can. So
Trish, because now so many places are doing it, like I saw Kroger was doing it, and there's all these different, there's like 6 locations in Crawford County. Is there like a database where you can see who's gotten it, or are you just?
Yes.
Okay.
So when we receive the vaccine, when we sign up to be a provider of COVID vaccine, we are also signing away that we will document the vaccine has been administered, what lot number, who administered it, all of that stuff within 24 hours into the state's immunization database. So if anybody has ever gotten a vaccine in the state of Ohio from the health department or from even your healthcare provider, if they provide VFC or the Vaccine for Children vaccinations, a lot of family providers, primary care providers will do that as well. we can pull your full immunization record. How many times did you get your flu shot? How many times, when was the last time you had a dose of your tetanus? Those types of things. This is in that exact same database, so we can pull that same full report.
So could you potentially get your first shot from the county health department and your second shot from a Kroger? And they would
It's
be
a
able to-
potential, it's not recommended.
Mhm.
It's really recommended to go to the same provider that you got your first one through, mainly because you want to make sure you don't know what type of vaccine
Oh, gotcha.
each provider may have at any given time. So what the state is doing, so what we've gotten thus far is Moderna. Okay, so we have the Moderna vaccine. So after we administer them, within 28 days, we need to be vaccinating their second dose, or those individuals with their second dose. So as we do that, they know that, hey, it's coming time for you to have this for this week. So they send us a distinct lot number for second round doses so that people are getting the same type.
Mhm.
That's how it's being shipped out to everybody. Now we understand that there may be some instances where maybe somebody can't make it to the other one, or maybe they've just moved into the area. We're already trying to work through some of the logistical issues for how do we phrase it? The snowbirds, if they've gotten their first dose in another state and they're coming back in the springtime, that type of thing. So we've got to be cognizant of that. So it's a lot of logistics.
Yeah.
It is
sounds
a
like
ton
it.
of logistics.
Yeah.
And we don't truly have like the full IT infrastructure for scheduling and this and that. So we're creating it on the fly and getting everything in there. That's why, as many people as we can get pre-registered online. And then if people are coming in or calling, we're actually doing the registration online as we're on the phone with them, so that everything's into the same system, the same database. That way it's time stamped. So we know who got registered before who, on what day, on what time, everything. So we're really trying to track some of that, and then getting them in as soon as possible.
Oh, great. That sounds good. Then how's the funding? That was the next thing. How's that?
Oh,
going?
well, funding is always a fun conversation when it comes to health department grants, because with these COVID dollars, we never know quite what to expect with them. Going into the 2021 budget, we only knew about $7,093. That's all that we knew that we were going to be getting in COVID funding for 2021 when we submitted our budget. Since then, we have been told there are 2 grants that will begin February 1. And again, all of our grants are reimbursable grants. And while we call them grants, they're technically a contract between us and Crawford County, because the grants coming down from the feds and then into the state, they do it by sending all of the funding to one jurisdiction within each county. And then any other jurisdictions, there are counties that have multiple city health departments in them. They then would have a written contract together. So we still have all the exact same requirements of the grant, but it's through a contract. So those grants that are coming forth here starting February 1st total just over $49,000. We are anticipating a number of additional ones. They just have not been able to determine anything, obviously with the change in leadership at the federal level. We have to wait for things to kind of flow through those processes as well. We were very, very lucky that on the federal side, any dollars that were deemed CARES Act dollars, 2 of the grants that we had last year are under that umbrella of CARES Act dollars. And initially, those would have had to have been spent by December 30th. And again, a large chunk of those, we had less than a month to really spend down by the time we even knew we were getting it.
Right.
So we had a really difficult time doing that. So when we looked at this, we were able to recoup a lot of our personnel costs from throughout the year. They allowed us to go back and retroactively recoup things like that. So it's not a tremendous amount, but just under 60,000 is rollover of that grant or the extension on those two grants. Then in addition, one of the other things to keep in mind is we also have received some of our reimbursements from November expenses, and then we're still anticipating our income on our December expenses that we submitted. So we just recently, less than a week ago, received just over $69,000 in revenue from all of our efforts in the month of November. In the month of February, in the month of February, we should be receiving our reimbursement of our December expenses, which are totaling just over 92,000. So these are expenses that we already had last year, but we're not receiving those reimbursements until this year. So those are all forthcoming. So that's, there's good things on the horizon there.
Yeah, that sounds like it. And then the final thing you were going to discuss was the program updates for.
Yeah, so we're still busy plugging away. We again are one of the few departments across the state that has not shut down any programs. We have not closed off any programs. We're still running every program, sometimes in a slightly different fashion, but we have not stopped anything. We're still doing car seat checks and providing those. We're still doing, lead and healthy homes pieces, which kind of brings us to, we have been awarded, or we will be receiving all of the final funding pieces on the lead grant. So we will be receiving that again. That's something that we have like a HEPA vac that we can loan out to people if they're doing construction in an older home, so that lead dust, when you're bringing things down, we don't have those issues. It's what has allowed us to provide like cleaning supplies, cleaning buckets, things along those lines to individuals for wet cleaning of lead dust particles, and then educating providers as well on the importance of lead screening. It is a requirement for young children to receive lead testing during their visits up to a certain age. So, we're able to educate the providers there and let them know that, hey, there are some additional resources that we have for families that are living in older homes if it's built, pre 1970 something. So
That's great that you
we are
were
doing
able
that.
to continue all of those things.
Yep. So we are going to be able to continue that. So we just got the contract on that. So we'll have all that set. We were anticipating it, but it's one of those you just never know. But we had anticipated that one. The mosquito grant that we've been able to help provide adulticide. We bought the new sprayer for the city truck and everything this last year. So we are submitting that grant here in the next week or so. And then once we know if we've received that, we'll know what to anticipate there. So we are, I believe, budgeting for being able to help the city out in purchasing their adulticide and things like that, the spray that actually goes into the truck. So looking at some of those components, we've also been able to, do the screen repair kits and things like that, the mosquito dunks. That you can put in standing water. So, we've been able to do that over the last several years whenever we've gotten that grant. So that's, and our environmental division is a one-woman shop. So she is busy, and then we're getting ready for food service licensing season. So we're still going through all that.
Wow, good.
A couple new tattoo establishments, body art establishments have opened up. So she's been busy doing all the reviews and everything like that on those, inspecting them. So that's something kind of newer for our department. Some of us have done it in other departments before we came here, but you know, it's not something that Galleon's had during the time that any of the staff here have been in place. So, you know, we're still working on that. Our sexual health, reproductive health and wellness clinic efforts, you know, we're growing. We're definitely growing. With COVID, there were a lot of places that were closed down that were just not seeing patients one-on-one. They were wanting to do telehealth. Some people weren't comfortable with that. So we were getting a lot of referrals to us. So we started building up that clientele more. One of the other program area updates for that is there is a sister grant to both the HIV and STI grants. It's called the Early Intervention Services Grant. And in that one is primarily focused on it flows really well along with the ones that we currently have. But it helps support some of the care and treatment for people that are low income, or that can't afford their treatment for HIV. So,
And are you planning on applying for that one as well?
the state actually contacted us and asked us to apply for it because they've seen everything that we've done. So we're pretty sure we have a good shot of getting it.
I would say if they called and asked you to apply.
They did, and I mean it is out for RFP, so others may apply. But we're really hopeful. Our team that we have in place is a good, solid team. They love what they do. If anybody has ever heard them talk about the services that we provide, you know they all light up when they talk about it.
Yeah.
And this would bring in an additional $115,000 annual, at least for the first year. Well, I believe there's 2 more years left in that grant. So looking at that, that's something that we're able to do with the requirements of that grant and movement of some staff that are already trained in some of those components. But the entity that currently holds that grant is more than willing to, you know, talk us through some of the different components that they do. A lot of it's dealing with insurance companies and calling pharmacies and dealing with that aspect where a lot of us, I think anybody on this call has tried to deal with an insurance company on the phone, trying to get something covered that they're just not ever going to cover. But finding all of the other programs, knowing all the programs that can help subsidize those things so that people don't just give up and not even seek out any kind of care or treatment. We want people to stay in some form of treatment so that they're able to, so that we're able to slow down the spread of this. So that's really the point of that piece. So,
Yeah. Well, thank you so much. That's a lot of, I think that all sounds really good. I mean, we're getting the vaccine going. I mean, I know you guys are really busy, but the fact that you were able to continue all your other programs that you're already doing without stopping any of those, as well as putting out doing the contact tracing and keeping the vaccine going, that's all really good news. So thank you for updating us.
Absolutely. I can say, you know, the staff are extremely dedicated. You know, we're all gung-ho, we're 100% pushing forward on being able to provide the services that we obviously know are needed. And then being able to take care of all the COVID issues as well. You know, it's something that we need to really keep in mind as we move forward. Eventually, the adrenaline rush, I don't like to say it that way, but it is adrenaline that's really keeping everybody going at this point. It's that fight or flight. We got to keep pushing forward to make all this stuff happen. At some point, when things start slowing down, we're going to see some crashes. So we're, you know, really trying to look at game plans on the mental health of any and all response workers, not just our own staff, but, you know, we've got EMS that have been out there constantly, the long-term care providers, everything like that. So, you know, it can be frustrating when people call. They do get very frustrated sometimes with us when they can't get through on the phone line because it's going nonstop, and we're doing the best we can to get through and talk to everybody that we can. Again, that's why we did like the pre-registration and such, you know, to try to narrow that down so people can get through for other program questions. But that's something to keep in mind, you know, just if you talk to anybody out in the community, give us a little bit of grace in that, you know, we are pushing forward. I think the staff's just doing a phenomenal job in every aspect there.
It certainly
It's not
sounds
easy.
like it. Yeah. And like you said, hopefully once we start seeing those second vaccines going out, hopefully, you know, everybody, including the hospitals, the EMS, will be able to take a little breath and everything. So, well, thank you very much for coming, Trish. We really appreciate it.
Absolutely. Yeah.
Always good to hear all the nice things you guys are doing. So, okay. Do we have any other business for the night? Is there anything else?
So
Okay. Alrighty then. If there's no other business, then I need a motion to adjourn.
we'll make the motion to adjourn.
Okay, and I will second that. So meeting is adjourned at 7:37. Wow.
Okay.
All right, bye guys.
All right.
Good night,
Thanks,
everybody.
everybody.